Well, we have 4 of 6, so we have a quorum. So in the interest of people's time, I have 8:30. We'll go ahead and get started. For my TAC members, did everyone receive the transcription of the last meeting? Those are currently serving as our minutes with our transition in court reporters. Any questions about that transcript? Any requests for changes?
I got it, and no questions.
Okay. Krista, Emily, all good?
All good.
Okay. Then I've got a list of things that were from the last meeting just to do some checkups and see where we are. I'm looking for names. If there's anyone from DMS that can let us know if the 92606 code was added to the speech schedule or not.
I do not know the answer to that. 92606.
And I don't see our usual contact. So I'm going to go ahead and leave that for our next meeting. We'll check on it again. But if in the meantime, we could find out, and if it's not going to be, get some backstory on what's the reasoning, that would be great. Any update from WellCare on the speech of Alan Treat on the same day?
Good morning to you, Dr. Ennis.
Good morning.
This is Stuart Owen from WellCare. I have a little bit of an update.
Okay.
I've got a meeting scheduled at the end of this week with the various parties involved to revisit. We've got the policy that we're going to review. Of course, you know, we have a committee anytime that we initiate a policy, revise a policy, you know, everybody got to get the appropriate people involved to look at it.
Sure.
So we got a meeting scheduled for that this coming Friday.
Okay.
And my guess is there may be follow-up. Well, I'm guessing there probably will need to be a follow-up meeting. But anyway, I have absolutely put this on the agenda. Everybody, let's look at this. And, you know, it shared the concerns from the Therapy TAC. You know, why do we have this for speech therapy, but not occupational therapy and physical therapy? You know, so anyway, we are going to look at it. So
Appreciate that. And any feedback from those meetings can be brought to our next meeting. That would be wonderful.
yeah, absolutely. Will do.
Thank you very much.
Certainly.
I don't see Dr. Cantor. Let me scroll down and see if she's down here. I don't see Dr. Cantor. I apologize if I'm missing her. She and I did have a phone conversation, another Zoom chat post our last meeting regarding many of the UHC policies that were published for Kentucky that we had concerns about. The peer-to-peer was the biggest one because it was referring MD to an MD, which takes the therapist who developed the plan of care completely out of the loop and doesn't make a lot of sense. They are still revisiting that, to my knowledge. I requested at least the discussion we had said that because care can only be denied under policy by a physician, that the peer-to-peer needed to be with a physician. And I suggested that other third-party payers are using peer-to-peer with therapists. So somehow they're getting around that. But that at least the providing therapist who developed the plan of care should be the one doing the peer-to-peer with that contact at the insurance company. And so I was waiting to hear back from her on that. I have not heard. But the other policies that we were having concerns about, having the progress notes signed in addition to the original plan of care, having to code time in, time out for every code. Even though those are listed in the policy they sent us as policy for UHC in Kentucky, she said those are not policy and they should not have to be followed. So I requested that they change their publication because what they have put out there says that those are policy. Again, I'm waiting to hear back. But this is happening on a national level with a number of payers, UHC included, where they'll put something out in policy, then say, oh, no, it's not really policy. But what has happened nationally is that they have come back later and used it for recoupment. And that's what we're concerned about happening. So we just want to make sure that it's obviously not the original intent, but if they're going to publish a policy, then, that's a challenge. So I would say keep those on the list for the next meeting, 3, 4, and 5 there. We also did not get any feedback on the signing of progress notes. I know that we have a time window for signing of original plan of care, but we were waiting to hear back on them from signing of progress notes, because that's, again, another burden, not only on the clinician, but on the referring physician. 7 is just following up on what are the timelines for updating the NCCI edits that are issued quarterly, because a lot of times they will get updated immediately in our EMRs, but because it apparently has some components of manual process, both for DMS and for the payers, things will be getting denied because they appear to be coded inaccurately and because it's taking time for them to upload. So we were talking in the last meeting about the timeline for those uploads of those codes, and I didn't know if anyone had an update on how long it generally takes for those codes, those edits to get uploaded.
I'm feeling kind of useless right now.
It's okay, Dr. Terrio, it's not necessarily your wheelhouse, so.
But I do know it takes a while. I don't know how long it takes because it has to go through several systems to get done. So I think that's more of a, I guess, policy question. And I can bring that back and try and get an answer.
And that would be great, because it's more administrative burden, right? When your system is updated automatically and you submit what's considered a correct code, and then it gets denied and has to be resubmitted, and it's just one more piece of administrative burden that's problematic. But we can't delay the billing because we have so long to turn in the bills. So finding some window to work in would be great. So I appreciate you checking on that. Thank you. The last thing from the previous meeting was the sample progress form that Dr. James reported on the last time. Did that get to DMS? Was it approved?
I don't know.
I received something, but I have emailed Angie Parker just to clarify that is exactly the proper document.
Okay.
I don't want to send you guys something that I wasn't sure was exactly what you were looking for.
And
so that is on me. I have not sent that out yet because I just wanted to make sure I sent the right document.
Sure.
I'll follow up with her today.
And I see Angie is on the call. Angie, do you know if that's gone through the DMS approval process?
I know that I was off last week, so I know that still catching up on email. I can look at that and maybe I can give you an answer before the end of this.
That would be great. Thank you so much.
If not, then we'll follow up.
I appreciate that. Erin, can you scroll up for me? Beautiful. Thank you so much. A couple of things that have been reported to me, and then I want to reach out to the other TAC members about things that have been reported to them. There are some concerns with credentialing taking a long amount of time. Specifically the original DMS credentialing. And I know that we're all doing it through the portal now. So I'm not sure. I didn't get a ton of specifics, but I did want to throw out and see if anyone else is having credentialing delays.
Beth, this is Pam Marshall.
Yeah.
I'll speak up because this has been a long-standing problem since 2014. We recently had a situation where a PT, I guess they're considered moderate, risk, and there was a misunderstanding of DMS, not understanding that we private practices have to credential providers long in advance before they ever start working. Because you can't afford to pay someone a full-time salary and them not be able to see patients. So you have to make sure Medicaid ID, all the credentialing, because
Correct.
again, to state that we independent providers have to go through the process of getting a Medicaid ID first. And that used to be fairly quick, and it's been taking longer recently. And then submit to all the MCOs, and all the MCOs, remember, have a different process. So that takes a lot of time to complete that whole process. And then they all have 90 days from the time they're receiving those documents to get that credentialing completed. And many of them are taking the full 90 days. And yes, we can hold claims, but there's some of them that there's not a guarantee of the effective date they're going to give us. Sometimes it's fairly random. Like if we submitted something today to an MCO, they wouldn't necessarily give today as our effective date, even though we have a Medicaid ID. The reason I think you're not hearing that this is a problem, because it's so cumbersome, that I believe there's a lot of private entities in the state that aren't following the rules. Therefore, they're just billing under other providers, and there's no one really checking on that. However, we follow the rules, and it's super cumbersome. And what happened in this recent situation with the PT, we credentialed her 3 months before she was ever starting. Got to the date, they had sent out, DMS, I guess, sent out a person to verify in April, was this provider at the location? Well, they showed up at the location the provider wasn't going to be working at anyway, and the front office staff had no idea who they were talking about, because they don't know who this PT is.
Sure.
And they didn't even contact us or contact our main administrative office to find out where would this provider be. And they showed up with the wrong expectation, expecting to see that provider and interview them to see if they were legitimate. First of all, that's completely backwards, because no, that provider wouldn't be there, because again, we're trying to credential months out before that person ever starts. So we fast forward, we get to June, that provider is now in, we still don't have a Medicaid ID after more than 90 days. And they had sent out this person to verify, several times, and it just was a confusing mess. We finally got it straightened out. But again, the person was, here our new provider was in orientation that day, and, proceeded to ask a bunch of questions, which just feels, could be perceived by this new person, oh, I'm doing something wrong. Like, this
Sure.
person's coming at me. So just the whole process needs to be looked at, because if PT is the only provider type that they're going to do this, that DMS is doing this for, there needs to be a better understanding of the process so that this confusion doesn't happen, because I'm telling you, every regulation was broken with that provider. And it's just very, very cumbersome. We have to babysit all the MCOs to push through the credentialing to get it done. And then we have randomness where providers will just fall out of network. For some reason, their claims will just start processing out of network. And you're kind of going, there has got to be an easier
And we're-
process than
Yeah,
this.
I've got that on the list as an upcoming issue as well. I know that we have tried to address credentialing for a number of years. I think it's been on the radar every year since we've started this TAC 8 years ago. I think it's certainly something that we can escalate to the MAC if needed, because uniform credentialing is something we have requested for a long time. At one point, we were discussing using CAQH as part of the process because it's something we all use anyway when we're credentialing outside of Medicaid for many third-party payers. And so all of our information is in there, all of our IDs, all of our licenses, place of service, requirements, all that kind of stuff. It didn't go anywhere back then, but we certainly could have that discussion again.
Dr. Ennis, I've got a couple cents maybe
Yes.
to add to this.
Please.
Beginning August the 1st, the Kentucky Hospital Association and Aperture, I think is the name of the company, I could be wrong,
Right.
have agreements with 3 of the MCOs, WellCare, Molina, and Aetna, I believe, and to do credentialing, to perform credentialing. So it will be one entity doing it for all 3 MCOs. So that
Can I speak up again? This
Sure.
is Pam. So Aperture has been a part of Passport / Molina for all these years since 2014, since we became a provider type that could bill Medicaid. And I'm telling you, that process isn't any easier. The question I think we need to be asking is if Medicaid stamps an approval, yes, credential this provider, I believe this provider is legitimate, here's the Medicaid ID. Why do the MCOs all have to go through their own individual processes? Like, why can't the process be verifying on CAQH, doing a fairly quick verification that they would then be able to be in network for all those entities? Is it regulation? Is it something I'm not understanding as to why that can't be the case? And why are we treated so differently than a hospital situation? I realize a hospital is managed by an MD, but in a sense, there's really no different whether a PT or an OT shows up at a hospital. They just verify them and no credentialing is needed. And I don't understand why this process has to be so cumbersome and long, and that it can't be streamlined, that once you get your Medicaid ID, that all the MCOs should then upload that provider as a legitimate provider.
And I will say, and credentialing is not my expertise, but my understanding actually is it should just be one. You're credentialed once, then you join the network, you negotiate reimbursement or whatever with the MCO. But as far as credentialing, my understanding is it should just be once.
But that's not what we're experiencing, because we're
Okay.
getting, as a provider, fortunately, our group knows how to do it. So we get very little pushback, meaning we fill everything out correctly and do everything correctly. But there's a lot of back and forth and verifying information. It's like they're going through their own little process. And Aperture is the same way. I mean, Aperture will send you, envelopes saying, we need this or we need that, or and I think that's happening. I would say if other providers can speak up on this call of what they're experiencing, it's just been our experience now since 2014 that each of those entities are doing their whole long list of verification. And sometimes there's someone in the state doing it for that MCO, and sometimes it's a national centers, and you have to, and those people always change. You have to, constantly be getting who's managing our credentialing. And sometimes we need reps to push stuff through because it just takes so long.
And I think, Pam, that's something that we can certainly push up to the MAC level, is that, if they're all requiring the same information and it was provided to DMS for credentialing there, is there a way to streamline that process? Because extra credentialing is cost for everybody, right? Going through that next level costs admin time for the practice, costs the insurance company time for manpower.
Yeah.
And there shouldn't necessarily be additional requirements for the MCOs for Medicaid, for a Medicaid provider. So
And
I think
Beth,
that's certainly something we can ask.
we've been stating that for years.
I know.
It is not only the MC, I mean, we have our reps even into, management of the MCO. It's not only costing time to credential, but I can't tell
To
you how many
maintain, yeah.
thousands and thousands and thousands of claims and projects to correct claims that are messed up because of credentialing and because of the way that provider wasn't loaded or wasn't credentialed in a timely manner. I mean, that's the part too that costs the MCO a ton of money. And it's part of the game to not pay claims, but it would be nice if that game were at least fair from the beginning.
So we can,
This is Hillary with Foundation. Pam is hitting it just correct, because that's the same stuff we're dealing with from front to end with those issues as well.
I don't know if this is going to make you feel better or worse, but the physicians have to do it too.
Mhm.
And so every insurance company, every hospital, medical staff, even the Office for Children with Special Health Care Needs, if you're going to be on their medical staff, all of those individual places credential you, which is basically, sending in the same information, and then they verify it. So
Dr. Terrio, the difference though for, working with other third-party payers outside of Medicare, Medicaid, is that we're able to do it through one source. We upload it to CAQH, they look at it there and they approve it. And so it just, and I've heard, Medicaid requires more. I didn't see more when I filled out the form. I saw the same information. There may be things that I didn't realize were different. But it seems like we're spending a lot of money, a lot of time, a lot of energy on all sides, providers, payers, everybody, doing the same work over and over and over again. And now paying KHA and Aperture to do it on top of that. When there's things that we're already doing for other payers, and physicians are doing the same thing. For credentialing, they could be tied in and save a lot of that time and energy and repetition. So I think we've requested that it be looked at before. I think we can do that again. I don't know if it's a contract component with the MCOs, that they have to do their own credentialing or can do their own credentialing or whatever it is. I haven't, we don't look at the contracts. So I don't know if that's a piece of it. But it certainly does contribute to that administrative burden piece that we've talked about just about every meeting for the last 8 years.
Yeah, and just to add to it, I wonder if the consideration would be for those low risk providers, the difference between a low risk provider like a speech or an OT. I don't know exactly. I guess it's the doctorate that's requiring PT to be considered moderate risk. I don't know what that is, but a PT can't do much different than an OT or a speech is my understanding, meaning I don't know why they're classified as moderate risk. But the physicians, and nurse practitioners and all the people that are dispensing medications and overseeing healthcare, I can see more scrutiny needed for that. But when it legitimately can be an online form that you're just filling out and it should be automatic, like, yep, that, some automatic way to get that approved or, get that provider loaded.
Dr. Terrio, do you suggest that we bring that as a concern to the MAC meeting? What are your thoughts?
I think that, what do you think, Ann? I think that would be a good idea.
Well, I would prefer to try to address it on the DMI side of things first.
Okay.
Before you came there. Obviously, that is something you can do. And, there are portions of the MCO contract that addresses credentialing. If you have specific examples where you're having challenges of that, I don't know if you've supplied those or not. We can certainly look at those.
We have a third provider chiming in with the same issues. I think the challenge is that it is so long-standing
Mhm.
and repetitive over the last 8 years that, digging back in for the specific examples,
I mean, if you have anything recent,
current,
just,
and
and
so
as
the
as you
three
may or may not
folks-
know, there was the CVO, I think it was a House bill, and I don't quote me on what all these House bills are.
I know.
But basically, they took that requirement away
Yeah.
within that. So but there is some entities such as you've mentioned, Aperture and KJ, that does do credentialing for providers that the MCOs do contract with to perform that. So is it an issue with the MCO? Is it an issue with Aperture or KJ? You bring up a lot of good, I can't think of the word, issues, I guess, like the right word, that you have, but they're supposed to get credentialing done within 45 days. Now, if what they are, if they're not loading it appropriately after their credentialing, that's another issue.
Right. The other question that I would have is that I know in some cases, kids that are applying for SSI disability waiver, that kind of thing, their approval is backdated to date of application. Is it possible to do the same thing with credentialing? I mean, I know the challenge with that would be if they didn't get credentialed, then you've got all of this care provided that wouldn't be covered. But I mean, if you've got a provider that's been credentialed with third-party payers outside of Medicaid, it's a pretty sure bet that they should be credentialed within Medicaid.
This is Jennifer with Program Integrity. Just from the Kentucky Medicaid side, we do backdate up to 1 year. We can backdate. There's certain circumstances and rules and all of that, but yes, we can backdate up to 1 year. No further back than that. In regard to the comments that have been made regarding the classification of needing the site visits, that sort of information, that comes on, I'm assuming you're referring to the Kentucky Medicaid side, since we do that. So that's determined in regulation. So we do have to do certain things for higher risk providers than others. That is specified and outlined in the regulations. What I would say to that, though, is the information that we use to gauge where we perform that site visit, all of that sort of information comes from the provider file. And so in listening to you all talk about how you load in different therapists, maybe there's a way in notes or something that we can capture information that we're not getting in regard to like the location that they would be practicing, that sort of thing, because we are going strictly by the contact information in the system. And we do make contact. We do actually make phone calls, but we're limited to what is on that provider file. So, maybe it's that we're missing some information that we need in order to get to the right place timely enough. So in those circumstances, I would encourage, I'll put my email address in the chat, reach out to me with problems like that or problems that you're having on the Kentucky Medicaid side. And if there's something that we can do and work through that, we're happy to do that, within the confines of what our requirements are. But we're certainly willing to work to improve that situation so that you're not waiting just because of a site visit or something like that.
And it sounds like things like work location that may be different from a main location and start date are things that may be missing.
Yes. It does.
Right. But can I speak up a second? Because this would be a great thing for you and I to work through what happened to this provider. Because one, we've never had a site visit for a PT before. This was the first time. And two, when you put start date, that's a confusing thing because we want the Medicaid effective date to be the day we submit the application, because it would hold up all of the, there might be some things on the form that need to be cleared up, and I'd be happy to work with you and give you feedback, because we have to put, the effective date has to be the day we submit, because then we're trying to submit to all the MCOs. And then that would hold up credentialing with them if we didn't have the start date or the effective date be now.
I think there are ways to work through that. Jennifer's email is in the chat. I'm going to suggest that Pam, Anna, and Hillary reach out to her along with any other providers that are on the call regarding the specific concerns they've had with this process, so that we can try to start to work through it.
Beth, another question is, because of this cumbersome process, I think it does create confusion. And I think there might be a lot of folks that aren't doing this whole process correctly. So that's another concern. And there's no one really regulating that,
Well,
who's
what I
doing it
would
right
say-
and who's doing it wrong.
What I would say right now, Pam, is let's try to figure out a way to streamline it, make it efficient, and then our organizations can communicate with membership
Yeah,
on best
that would be good.
practices. I think that's why we're here. So,
Right. Yeah, that I care about that we're all informed and everyone's doing it uniformly.
okay, so Jennifer's email is in the chat. Again, I'd ask anybody who's having credentialing challenges to reach out to her and see what we can work through in this process. The last thing that is listed under new business, and I've got a couple more that have come up since then. Given that we are still in whatever our new normal is with work remote and things like that, it has been a challenge for providers to reach people at DMS. And we weren't sure, given that, remote work's going to continue for whatever the foreseeable future is. Are there any plans to improve accessibility of those Medicaid folks?
Can you give me specifics on who you're having, on who they're trying to get a hold of?
I'm going to reach
they're
out
having
to
challenges with, because that would be helpful if it's certain areas or, but I mean, at this point, telecommuting is still occurring.
Absolutely.
But it would
Beth,
be,
I can let you know that DMS has been working on transitioning our fax to emails. So that is a step that we've been taking to ensure that faxes are not sitting on the fax machine. I monitor one of those boxes personally. I know there has been a lot of calls that aren't always getting through due to my cell phone is forwarded, my work cell phone is forwarded from my office phone. And if you call and hit my extension, it gives you a busy signal. So I know that has been some issues that we've been trying to work through. If they're always welcome to email me. I can always try to, push those through. I have some TAC members who reach out to me from time to time with different issues. If they don't know who their correct contact person is, I'm always happy to facilitate the best I can.
Thank you.
If I don't know the contact, I'll find it.
Appreciate that. Can you do me a favor and put your email in the chat box so that folks can, that would be great.
Absolutely. And like Angie said, if you have any, specific examples or certain areas, just let us know and we can try to reach out to that group and find the best way to communicate with them. And we apologize. We know it's a little chaotic, everybody being at home. I mean, I work at my kitchen table. So, but please feel free to reach out to me if anyone's ever having any issues. We're always here to help. And I do know sometimes, like the directors, I wouldn't want to see their email boxes. I can only imagine
What it looks like. Yes.
They get. So, we are working towards trying to streamline to where we are available and easy access to the best that we can. So I will drop my email in the chat and you're always welcome to reach out to me.
That would be perfect.
This is Leslie. I feel pretty confident that if you put Erin's email on your CC list, that she will make sure it gets followed up. She follows up daily with things with us. So, and again, I would like to apologize as well if we haven't answered anything back. We have removed, most of us removed our phone numbers and just have our email addresses. So I check my email and carry my phone with me constantly. So again, if you can't get Erin or someone else, you can also CC me. Erin, would you put my email with yours in the chat, please?
Absolutely.
Thank you. And just for our court reporter's sake, Linda DeRossa, our fifth TAC member, just joined the meeting. Couple of other things that have come up, and I've seen it in the chat as well from some of our providers that are online. Specifically, I've heard with UHC, but I don't know if it's happening with other MCOs. We're having credentialed providers drop off and be noted as out of network suddenly for no apparent reason. So I didn't know if we had anyone from United on the phone or on the Zoom. I don't know. I don't see Dr. Cantor, and she was the one that was on last time. So I will reach out to her and see if there's something that needs to be done on their back end, because it seems to be happening to more than one provider.
Hi, Beth.
I'm sorry, go ahead.
Hi, Beth. This is Lenore from United. Dr. Cantor is not on, but I can take that back to her and follow up.
That would be great. It's happened to several providers where they were credentialed, they were in network, and then all of a sudden they're getting denied for out of network. And then is there anyone on from Aetna?
Hey, Beth, can I just contribute to UHC? And I'm not sure this is a good time to see if other providers are experiencing the same thing. We chose to take a very small number of patients just to see how it would go, because we did a lot of negotiations at the beginning, making sure we weren't caught in all those little games, I call it, that they want to play. And the amount of problems that we have, that it's really almost just not worth working with UHC, the amount of constant issues that we're having with such a small number of patients. So I'm not sure if other people are experiencing the same type of thing, but it's not going smoothly at all.
What I would say, Pam, is if you can send some specifics to Dale, because he will be taking over from here. And I will make sure he has contact information for UHC, and then other providers who are having issues, if you can send specifics to him as well. That way we can have specific details to provide to the MCOs to work with them.
Yeah, and some of it is around, if you remember years ago, back in 2016, when we had an entity that was managing PAs for one MCO that was restricting like 6 visits in a 90-day period or something like that. And that, those are the kind of things we're seeing, or denying when it is medically necessary, different, lots of different things, even claims.
Pre-cert across the board has been a challenge.
Yeah, it's
with
not
a number
going
of providers
smoothly at all.
And then back to Aetna, Becky, I think you're on here. We do have some providers who are having claims denied, saying they don't have a pre-cert when the pre-cert number is on the claim, and they're having trouble reaching a provider rep. Is there someone they should reach out to specifically?
They can reach out to me, and then I can go from there and let them know who their provider rep is. So if you just want to go ahead and give them my contact.
Can you put it in the chat?
I sure will.
That would be wonderful.
Thank you.
I appreciate it.
You're welcome.
Beth, I'll send an email with everybody's email addresses after the meeting. So
That
that's
would be perfect. Thank you, Erin, because I know some people are on their phones and may not be able to access the chat. So I'm going to reach out to my other TAC members. Any other issues you guys are hearing about?
I have a couple of code things, Beth, from a call that was submitted. Just questions on needing clarification. One of them was about the OT, the new feeding code that was added to the Medicaid feeding schedule this year. She said, if you see a child for 60 minutes, do you bill 4 units of the timed code and 1 unit feeding, or do you do 3 units of the time code and 1 unit feeding? So I guess there's a question on how to break up the units.
And I think that would depend on the descriptions on the code specifically.
Yeah, I think that was the question, was that it wasn't clear on the.
Can you do me a favor and send me those and I'll see what I can find out?
Uh-huh. And the other one has to do with the PT, the gate training code. It was changed to, well, she's saying that it was changed to an untimed code. And on the okay, yeah, that's what I wasn't, I don't think so, but
Gate training is gate training. It's always been a timed code.
okay. Well, I noticed on the fee schedule, it does say, episode.
Ugh.
Um,
I will be perfectly honest. I did not look at the fee schedule once it got posted to make sure that timed codes were posted as timed and episode
yeah,
codes were posted.
I think that, so, and then she was seeing in other places that it is timed and I'm like, yeah, so it does say episode. I checked it just today. So 97116 is the code.
Yes. So if someone from Medicaid could check on that, please, because 97116 is a per 15-minute code.
And maybe check to make sure the other ones are correct. We don't do aquatic therapy, but that one also says episode.
And
So,
that is also a timed code.
okay. There's several others. So maybe just that needs to be, yeah.
Okay. Dr. Terrio, I'm going to pull up the current fee schedule and take a look at it this morning. And I will shoot back to Aaron anything that needs to be corrected. Okay. We had that problem several years ago and I was hoping we had it fixed, but apparently. And I don't know how it gets changed when they're reloading a fee schedule from the year before where we had it all fixed. Yeah.
One of life's mysteries, right?
Absolutely. Any other things from TAC members? Thank you, Krista.
Nothing here.
Beth, I don't have an issue. I said, but I just wanted to let you know that I was actually on the majority of the call. I was on when you were talking about carrying over items 3 and 4 and everything. So my video just issue for early on.
It's all good. I appreciate it, Linda. Emily, you good?
Quiet as a church mouse today.
Okay. The one other thing that I'm going to bring up is this is my final TAC meeting. So I will no longer be on these, but I will do the follow-up today with the code list to Aaron. Dale has expressed an interest in taking over as the chair. So I wanted to throw out to the other TAC members. 5 out of 6 of us are here. Anybody opposed? Let's go that way to Dale taking over as the chair.
I'm in agreement.
All right. Dale, it's your circus from here on out. I will also not be able to attend the MAC meeting because I'm running bike camp that week. So I'm going to be a hot, sweaty mess. So if you would be able to do that, that would be wonderful.
Will.
Thank you, Dr. Terrio. I appreciate that tremendously. Is there anything, I think we're working through a lot of this at the TAC level. Is there anything we want to escalate at this point, or do we feel like we can continue to work through these issues here? Okay. Hearing crickets, I'm going to go with we'll keep working on them here. So Dale, you don't have to submit anything to the MAC, just do a brief report on some of the stuff we're working through and let them know that we will be in touch. I appreciate everybody's kind words in the chat. Thank you so very much. I'll be in and out of Kentucky for the next few months, but then I'm settling in down here. So
Hey, Beth, do you have the same email address?
I'm keeping the Gmail, the PT for Kids 47 at gmail.com. So that one is going to remain in effect. My Bellarmine email will go away eventually. But my other one is bennis@usa.edu.
Beth, where are you moving to? I didn't hear.
I am now the program director for the 3 PT programs for the University of St. Augustine in Florida. So I have 2 programs in St. Augustine and 1 in Miami. So I'm moving down.
Congratulations.
Thank you very much. I appreciate that.
And thank you for your time and
Well, I appreciate it. It's been an interesting 8 years. with lots of change and lots of process. But I think we've done some really good things, and I look forward to seeing what you guys do in the future. Anything else that we need to cover today? All right, then I wish you guys well, and I will take a quick look at that fee schedule while I'm sitting here. Have a good day, guys. Take care.
Thank you. Best wishes, Dr. Ennis.
Thank you so much, Stuart. I appreciate it.